I'm going to lay down a few tracks. Just kidding. Thank you very much for that passionate and well done introduction. I have some people here to acknowledge, but it's basically a lot of the foundation of what our party is and should be are in this room, and I want to express my thanks to all of you. You know, from time to time in this debate during healthcare, you know, I've kind of felt that sometimes we as Democrats, we come into knife fights carrying library books. That we sometimes become so intellectualized about things, we develop such a fidelity to process that we forget that politics for the other team is what they don't want. They don't want anyone who's not already ahead to get ahead. They don't want anyone who's lacking to get the care they need. They have a frankly much easier job to do because they just have to stop anything from happening. But as a result, what it means is that they have a sense when they come into every single fight that they're going to punch and punch and punch. And this year, we showed them that we can take a punch and give one back as well, and that's why we did it. Let me also say thanks to you for a different reason. You know, there is this general sense that after the election, after President Obama was elected, we all kind of exhaled and said, wasn't that great? Wasn't that a great thing? And a lot of people looked for outlets to say, you know what, I'm not done yet. There are other things that I want to accomplish. There are other ways that I want this country to get better. The organizations represented in this room immediately got back to work. Immediately started putting together forums for people to talk about things like healthcare, to talk about things like global climate change. You gave people an outlet, and we needed it. We needed it, and you kept people active, and it was very helpful to me moving forward in this to know how many people were working so hard. Let me just say a couple of quick things about healthcare, and then I do want to try to have a little bit of a conversation. You know, there really was this idea that emerged as this campaign went on for healthcare, that people would sometimes say, why is it that the two parties can't just get along and work this out? Maybe if we just let the Gang of Six, remember those guys? The Gang of Six. Just maybe they work for a while. Maybe suddenly Senator Enzi will come up with the solution out here. Or maybe if we just persuaded Olympia Snow to come on board. Or maybe if we just waited for Joe Lieberman's schizophrenia medication to kick in. Maybe everything would fall into place. But in fact, that we forgot is one of the things about American politics that's so nourishing is we believe things. We're Democrats and progressives because we believe stuff. It's not just because we have an idea that we're willing to take a third of it or a quarter of it and then move along, or, okay, you've got a crummy idea, I'll take that one too. We believe things, and that's why we're passionate about public life and why we're passionate about politics. That's why we're patriotic, because we feel things strongly about how our country should be. And we, from time to time, and I would say this, even the president from time to time forgot that basic element of this conversation. That we're fighting for health care for more Americans because we believe that people should have health care. We believe it because for them, we believe it because it's right for us as taxpayers, we believe it because it's right for us as families that are struggling to pay our bills. We believe these things. And much of the debate was divided in this country because we were right and they were wrong. And we were unwilling to just say, okay, we'll be wrong too. And that wasn't a bad thing about American life. That was a good thing. That was a thing that we should be proud of. When people say, you know what, why don't we just not cover everybody? Or why don't we just go with a little bill that gives some protections? We said, no, we want to fight for these things. Now, we didn't get everything I wanted. And I think if I probably took a show of hands, we'd say probably not everything that any of us wanted. I believe we made some pretty fundamental mistakes from where we began. And I'm a pragmatic politician, but a good part of me thinks that the best politics would have been actually to do the right thing here, to have single-payer health care, Medicare for all Americans. But I'll tell you the great unspoken truth about this bill that very few people have realized. We have, with the passage of this law, we've now created a foundation on which so much can build. We now are going to have exchanges throughout the country that putting in a public option is not going to be that hard. It's not going to be that difficult to do. We've now extended the life of Medicare at least another 10 years, that if we decide, you know what, we want to make it for people 55 and over, not 65, now we can do it. We have a system of regulations around the country governing insurance companies that we didn't have before, that now we're going to be able to add to. We have certain basic requirements we're going to be able to augment each year. We truly have done what was said in the introduction, laid the foundation on which we're going to be able to build a lot more in the future. And we should not stop trying. You know, this feels pretty good winning one of these. You know, I've been in Congress for 12 years. When I started in Congress, some of you knew me then, I was 6'4", 270 pounds. This is all that's left. And for some reason my neck was shorter. That I don't understand. But I can tell you, having a Democratic president and a Democratic House and a Democratic Senate and a Democratic country makes a difference. And we have to fight this year to make sure we keep it. And let me say one final thing about politics before and I'd be glad to just to hear some questions if that's all right, Maestro. You know, there was a lot of hand-wringing after the Massachusetts Senate election. You know, what happened, what went wrong. And there was a lot of speculation about it meant what it meant, and even I said, you know, if we think nothing happened, we were wrong. But now there have been 3 different polls that have come out, polling people who actually voted in the election, asking them what they felt and why they voted the way they did. Now, putting aside the small fraction of our population that likes the idea of a swimsuit model being a senator, which isn't a bad thing, most people said they voted against the Democratic candidate not because we were trying to do too much, but because we didn't do enough. Yeah. We weren't doing enough to solve the problem. This idea that has gotten out there that somehow we were overreaching, actually the American people of both our base and the center were saying something different, saying you're not doing enough to solve our problems quickly enough. That's a message to all of us in this room, that we have to lean forward into these things that are going to be coming up. There's some tough things. We're going to finally fix the wrong-headed immigration policies of this country. We're finally going to reel in the worst abuse of the financial services community. We're finally, and I don't care what anyone says, we are going to do it. We are finally going to get a handle on the policies of this country and our people that are contributing to global climate change. We live in a city that's surrounded by water. If we don't do it because it's good for the world, let's do it just so that we don't have to wade through Lower Manhattan. You know, I represent the Rockaway Peninsula. 120,000 residents live in a barrier island here in New York City. Okay, I can tell you something's happening. We have no beach anymore. The Belt Parkway is about 3 feet from being washed into the sea. We have to do something. All of these things are going to get tough. Not a single one of them is going to be different from this debate. So let me conclude with this thought. You know, I think that if we learned a meta lesson in this healthcare debate, it's that we have to start fighting sooner. Good. That we have to start internalizing the idea that we are a country that's very divided on some big ideological things. And every single moment that we are stroking our beards and gazing at our navel and thinking about the world we'd like to be and singing Kumbaya, that's another day that we're not punching Bill O'Reilly in the nose. Yeah. So we have to take this into our fights. Not that we are going to be the anti-intellectual party. We're going to be the guys coming up with ideas, but realizing that we now have the ground troops to fight to make them a reality, that we're not going to duck a fight, we're going to take it on head on, and you won't see them the way I see them, but sometime in the next several years, there are literally going to be millions of families that are going to have something that most of our families were able to give us, which is health insurance. That's not a trivial thing. We're losing a hospital in Manhattan. We lost 3 in Queens. Maybe now we're going to stop losing healthcare services in our city and start gaining them. And when that happens, I want to say to you how grateful we are. Thank you very much, and God bless the United States of America.